We are still discussing tackling major health challenges. This takes me to the next question. Say, how well is the government doing in equipping our medical facilities with modern ones?
Well, yes, the government is there. Government should be accountable to the populace. I will say, as far as health is concerned, yes, government is doing something.
But they're not getting there.
Yes, I mean, government can always do more. Government can always do better. We know that if we go to our hospitals, especially the public hospitals, we know that, I mean, there is so much to be desired there. Going to the hospital is almost like, life, as if even your life depends on it, because you have to queue, you have to wait to see the doctor. The facilities you might even be told there are no beds, there are no bed spaces. There are no doctor on seat, only one doctor to see maybe like 500 patients. So there are so many challenges.
No oxygen, just here and there.
The infrastructure. The health infrastructure is lacking. Some hospitals don't have electricity. Some don't have water. All those basic amenities. They don't have the healthcare providers. There are no doctors. I mean, we all know about the JAPA syndrome, the brain drain. We've lost so many of our healthcare professionals, and all these are having a negative impact.
Yes.
Here. So government really needs to. Government has a lot to do. First of all, government should create awareness. Government should make Nigerians realize that, look, your health, first of all, it starts with you, the individual, anyway. It starts with you. Your health is your personal responsibility. But then the government also has its own role to play. Government should make sure that, look, if you need to see a doctor and go to the hospital, the doctor should be there. If you need drugs, the drugs should be available. The hospital, you don't have to travel long distances to get to the hospital. And you shouldn't get there and they say no bed, no electricity, no water. So government must ensure that the health infrastructure is in place. The healthcare personnel, trained healthcare personnel, are there. That there are no strikes. You don't have stresses. You don't have issues in the healthcare industry. So that is government's role, to make sure that health is accessible, is available, and is affordable to the people. So government needs to play that role.
Because most of the facilities in government hospitals are obsolete. So they need to buy new, modern medical facilities.
Definitely.
And the other thing again is that the government people also make sure that they attend these hospitals in Nigeria. Because they like to travel abroad, that's why they give less attention to what is happening here in the country. Because they can afford to travel out and receive the medical attention. So please, we put our house in order, that will be reduced.
Sure.
Please, government, those of you involved or concerned, so the Minister of Health and all, please listen to us and make sure there are provision of the facilities in our hospitals and create more health centers so that you don't travel far before you get medication or before one be attended to. The person may even die in the car because of that long distance and all that. So please, government, we are begging again. We have a lot to do, and we will not stop calling you because that is what you owe us as citizens. You owe us that at least when we are sick, we'll be able to access good medical facility. Then can the society and community be rid of diseases? Is it possible?
Yeah, there are some diseases that are preventable, like I said.
Yeah.
So far, in medical history, we're only aware of one disease that has been eradicated.
Completely?
Yes, and that is smallpox. Because, I mean, as a result of vaccination. But we find that there are so many other diseases that...
We have smallpox and chickenpox. The chickenpox still...
Yes, there's chickenpox. They're different. They're not...
I know. But is that one still in Nigeria?
Of course. It is. Chickenpox is very common. It's very common. It's one of the infectious diseases. Earlier, I didn't want to go too much into details. You have diseases that are infectious.
Of course.
You have the non-communicable ones. So Those are the infectious ones. And some diseases, well, because medicine is dynamic. So
That's
we
true.
cannot really say what is not possible today may become possible tomorrow.
That's true.
But there are some disorders that, as of now, they are not eradicable. They have not been shown to be eradicable. Let's take malaria, for instance. Many people have asked the question, why is malaria? Because one thing about malaria is that you cannot really say you are cured. Because you can, even if you are treated for malaria, you get better.
Can only give you a little gap.
Yes, you can still come down with malaria again. You know, unlike some diseases
Some
that
suffer it
they tell
4
you,
times in a year.
yes,
even.
you are cured. And one thing about Nigeria, well, Nigeria is lucky in quotes. Nigeria is right in the belt, malaria belt. You know, Nigeria is a tropical country. We're in the middle of the tropics. And it's said that about 97% of the Nigerian population are at risk of malaria. So there is no escaping it. You know, the only thing is that, well, nature has been kind to us too in some way, because nature has given us some
And there's no vaccine
protection.
yet for malaria.
There are vaccines.
For malaria.
Yes,
Okay.
there are vaccines. But the only issue is that there has not been what is called a universal vaccine.
Okay.
There are some vaccines that have been introduced now. In fact, there is one that WHO just introduced now. A trial is going on in some African countries.
Okay.
Unfortunately, Nigeria is left out. Ghana is one of the countries, and that vaccine is being used, for children.
Okay, for now.
For infants under 5. Yeah, it's a trial
Okay.
that's still going on to see maybe what a vaccine will just do is that it will prevent, it may not really completely prevent you from having malaria, but it reduces the attacks and the severity.
Yeah.
And that will also, reduce the mortality rate and all that. So some diseases can be eradicated, but there are some that so far, science is still working on them.
Yeah, no, when you also talk about some of these things from the children, what about measles? Can we, as it been
Yeah,
off
measles.
completely?
Well, yeah, there are some diseases that are known as diseases of underdevelopment.
Yeah.
Yes, and measles is one of those, because you won't find measles in an industrialized country.
Yeah. Even the malaria we're talking about. It's not.
Yes,
Yeah.
well, for malaria, like I said, malaria is a tropical disease. So it's more prevalent in the tropical areas, Africa, Asia.
Yeah.
Europe is temperate. There are mosquitoes there. If a Nigerian goes to Europe or to the US, you can still come down with malaria, even if you are not bitten by the mosquito, because the parasite is already in your blood.
In our blood.
So once your immunity drops, you develop the malaria. So malaria is one of the, malaria is interesting. Some people say ordinary malaria, but there's really nothing ordinary about malaria. It's one of the most complex diseases, because it has a parasite side and also a vector side, the mosquito or the parasite. So science is just working on both issues. But most of the diseases we have in Nigeria here that we are suffering from, they are really preventable. They are preventable. Like she said, measles. Measles is preventable. We shouldn't be having measles. We shouldn't be having cholera. We shouldn't be having diphtheria. All these diseases that are coming up now, we shouldn't be having them. They are diseases of underdevelopment and poor health care, poverty, and things like that. So they are preventable and, they are also eradicable.
And when you mention malnutrition, it's a result of poverty. And all that.
Yes, malnutrition is a result of poverty and also ignorance. It could be a mixture of both.
All right. Lastly, from my side now, what are the roles of government, community leaders, citizens, and doctors in protecting and preserving the health of everyone?
Okay, I will go back to government.
Again.
I will go back to government, because the buck stops in government's doorstep.
They have more role to play, actually.
One thing government really needs to do about the health sector, government should invest more. In 2000, I'm sure we've heard of the Abuja Declaration. In 2001, African leaders met in Abuja and they signed a declaration. It was called the Abuja Declaration. What the declaration said was that each country will dedicate at least 15% of their annual budget to health. Nigeria signed, of course, the meeting took place here. Nigeria signed that declaration. But I can tell you that this is 2023. That's about 22 years after that declaration. Nigeria has not for once met that declaration. The only time Nigeria went close, I will not even say close, that was in 2006, when Nigeria, dedicated about 6%. That's the highest that the health
from 15%
sector has ever received in Nigeria. So there is inadequate funding, inadequate budgetary allocation to the health sector.
Yeah.
And apart from that, there is also unequal distribution, because even when the health sector gets the beat it gets from the national budget, the distribution, where that the funds, how it is distributed, is also
an issue.
Yes, it's not realistic. So government needs to do that to make sure that the issue of health care is prioritized. There is no government that has prioritized health. Because if health is prioritized,
health and education, these two,
health will get a lion's share. Defense gets more than health.
And yet you still have a lot of trouble.
Yes. But we all know, like we said earlier, if you're not healthy, if any one of us here is unhealthy today, we won't be able to come here. So it's health first. So government needs to prioritize health by allocating enough resources and also making sure there is equitable distribution of these resources. So that is for government. Now for the community, yes, we have the community leaders. Community leaders should make sure that, there is mobilization. The community is mobilized. Do a lot of sensitization, awareness, create awareness, let people know. Hospitals are here. You should go to the hospital. Like you said, if you have a headache is just a symptom. A headache is not an illness.
Yes.
A headache is a symptom. And if you take paracetamol, you're only treating that symptom. You're not treating the root cause. So you need to go to the hospital. Some people will say, I'm feeling feverish. It must be malaria. How do you know? You have not done a test. You have not gone to the lab. Yes. So fever is also a symptom. There are 1,000 reasons why you can have a fever.
Yeah.
So you need to go to the hospital. And that is why community mobilization and education and awareness is important. Then lastly, as I said earlier, the individual. Your health is your primary responsibility. If you don't take care of yourself, then you cannot hold anybody responsible. It starts with you. So you have to ensure that you are healthy. You need to go for checkup. There are some ailments that you don't need to wait for symptoms. You go for a routine check. There's eye check, there's dental check. There are some checks like that you just go for. They are periodical tests. You need to go for them. As Nigerians, we need to develop.
There's no money now.
Yeah, exactly. We need to develop that attitude to be health conscious. We should be proactive about our health. Today, what we do in Nigeria is that we are reactive.
Yes.
We only take action when something has happened. But if we take action before it happens, we prevent it.
Yes.
So that is it. And
then we spend less.
Yes, we spend less.
Yes. But they don't understand.
We
because
spend
if
less.
you don't take action, you're going to spend more money.
We spend less. So I wanted to talk about health insurance because, like she mentioned, it's about money. When people hear about insurance, some of us have vehicles here. We insure our vehicles. The cheapest motor vehicle in Nigeria now, third party, is 15,000 per annum. I'm sure that some people, if they go to the hospital and they are given a bill of 15,000 to buy drugs, they will raise the roof. That is
high.
Spending 50,000 on yourself. So it is good to get health insurance. Health insurance doesn't mean you are praying to fall sick. It's just like preparation. You're being proactive that in case I fall ill, and if you take a health, there are so many community health insurances, there are so many around. There's one you can take for yourself, personal one. Maybe you pay just 30,000 or 40,000 per annum. And you can get, treatment that is far in excess of that. So we need to change that attitude to be health conscious and be proactive about our health.
And I think it's also good that our youths, particularly because this program is majorly for them,
Yes.
they should also, apart from having this routine, they also involve themselves in sports activity, exercise. Some youth don't even, they feel because we are young, no need to do exercise. Some
Exactly.
they just play with the exercise. It's also very key, even to the elderly ones too. You're not expected to run, but you can take a walk around your house. You don't even need to go far. In your compound, just walk around. Before you do
Definitely.
10, 50 times, that will also help. So that as well we can also cushion it to be sure that we are able to tackle these health challenges. Routine check is very, very important. Routine check. You don't need to have money so much before you do your checks. Let's begin from there. Because we have spoken to government all the time, and sometimes it's like the adamant to the plea of the citizens. But we believe that we will not stop. We'll continue to talk to them, and God will help us one day. Our cry will be heard, and they will do the needful, so that everyone in Nigeria will be able to access health with ease without spending
So can
much.
I chip in something regarding the exercise?
Yeah.
Very good point you mentioned. Health and education they're interlinked.
Yes.
And you'll see that in households where the mother, the woman is educated, that household will be healthier, because her education, she will be able to apply that knowledge. Now, why I'm saying that, we see so many schools around. There are so many schools. These schools don't have playgrounds. We have schools that are even, residential buildings. They don't have playground. Nursery schools where you have, little children, they're so energetic. You see them, they need to run, they need to climb, they need to jump. It's natural because they have so much energy.
Yeah.
And they need to exert this energy. But because you don't have this, there's no space, everything is cramped. So they cannot really, and all this has adverse effects on their health. It has adverse effects on their growth, on their well-being. And as for those who are, the adults too, our environment is not health-friendly. Even if you say you want to take a walk, where do you want to take a walk? In your area, where do you want to take a walk? There are no walkways. You can't walk, even where there are walkways.
You can tell with vehicles flying here.
Yes, either you have the Okada or the trader. Somebody has placed wares there, obstructions, everything. So the environment itself is not friendly for health, good health, for us to be healthy and to, there's so much pollution and all that. So we go back to government again to appeal that government should ensure that they produce that conducive environment for us, and that will make us healthier.
Thank you so much. We will go for a break now. When we return, we enter question and answer session. Vivid View.
See and do.